An atoll is just a dot in the Pacific Ocean made of water and reef, scattered with a few tiny, low islands. Since the United States inherited the care of these islands after World War II, the island governments have struggled with inadequate resources to provide health care for their people.
You know, we take it for granted in the U.S. that we can walk into a hospital and get the treatment that we need. But I believe that everyone deserves, you know, the right to be able to be treated equally and fairly in the healthcare system. And it's very sad to me because a lot of the infections we see probably wouldn't reach the level that they have been if some of their other medical needs had been addressed and been treated prior to us seeing them.
A lot of the patients that we've treated here just in 2 weeks would have gone untreated for probably years, if not ever gotten treated. So some of these trauma patients would have probably never been shipped off the island. It takes a tremendous amount of resources to get them out of here, and the closest essentially tertiary care centers are Tripler or the Philippines. And so it takes a lot of monetary resources. If they're not well connected, if they don't have the best insurances, they're just out of luck.
The cost of sending these people off island would be tremendous. There's the airfare, they have to put them up in a hotel, the hospital costs, they even have to send a caregiver with them. So they simply don't have the resources to do that. Canvasback fills that need.
A few islands have small government hospitals that provide primary health care. They don't have the resources to provide a specialist with all the supplies and equipment he needs. So Canvasback's teams becomes the specialty teams, and within 2 weeks we could provide close to $1 million worth of care.
Right now, the outpatient area is overflow because Canvasback team is here. And the people here on island, they really have faith, good faith in the Canvasback team, medical team. They know that they will provide the service that the people of the RMI really needs.
In 1986, Amata Kabua, the president and the traditional king of the Marshall Islands, asked Canvasback to do a diabetes reversal program for his people. He realized that after the Second World War, when these islands became the responsibility of the United States, that diabetes was increasing alarmingly, and the age at onset was decreasing.
Diabetes here in the Marshall Islands, it's a big problem because approximately 90% of people dying because of diabetes problem. And I know that it's getting worse. It's going higher and higher each year.
Our grandparents and great-grandparents did not have diabetes, and they were all eating fish and local food. But right now, with our generation, we're eating all processed food. Yeah, instead of growing our own local food, we go and buy all this processed food. Yeah, we'll replace the breadfruit with rice. Yeah, we come and sell the breadfruit and go and buy a bag of rice, or we come and sell coconut drinks and go and buy sodas or buy luau's, all these sweet drinks. So we are replacing this good food with the processed food. But with the education that we will gain of what causes diabetes, then it will help the population.
Next, the United States Department of Defense gave Canvasback a grant that enabled us to convert an abandoned and rat-infested wing of the old hospital into this beautiful 6,000 square foot wellness center.
By having to be one of wellness center student, in one of those programs, I come to find out what is fiber means and how do you get that and what it does to you. We learn also about the food, the quality of food, the value of the food, and what they do to our body, and also how important it is to have an exercise every single day. Because without exercising and without having a good food, we will never be able to prevent diabetes.
The three-pronged effort to reverse the epidemic of diabetes in the Marshall Islands is first, lifestyle interventions in our wellness clinic where we teach people to reverse their diabetes. We see blood sugars of 400 normalized with just diet and exercise.
The second prong is family gardening. The people here say, we know we have to eat healthy foods, but we can't afford it. So Canvasback's container gardening methods teach Marshallese families how to grow their own food and feed their family.
The third and the most important prong is education. Curriculum in the schools, cooking classes for civic organizations in the churches, posters, every way that we can reach the people.
We need to teach the children how to make healthy choices. Once the children understand what healthy food is, how to live a healthy lifestyle, they will teach their families, they will teach their parents. And we really feel like that's the key to reversing the epidemic of diabetes.
We are not here as a mission to show the people and tell the people and be the people in charge. We're really here as cheerleaders. The long-term goal is for us to see the Marshallese people having control of the diabetes epidemic and they being able to run the programs that are going to bring the cure to their people long-term.
Working here means so much to me because both of my grandfathers, they died because of diabetes. So I love working here because I want to reach my hand to all those struggling with their diabetes problem. I also want to reach out to those kids growing up, the younger generation. I want to tell them that we have to start making change, because if not now, then when? And if not us, then who? I mean, this is our time. They have the time to make change, starting now.
My feeling is that we're here on this earth to help others. And I think that with Canvasback, that their focus is special in that sense.
What I always think about when I'm on these trips is that I come with this perception of what I think we're going to be accomplishing, yet always knowing that I'll learn more from the people than I'll be able to give to them. And we do have the ability to give our services to someone who doesn't have the services here. And so of course that's one reason, that is just to come and serve a community as best we can in a short period of time to meet some of their healthcare needs.
This is, I think, getting down to the heart of medicine where we can just treat patients. Just helping people is essentially what medicine's all about. And I've really benefited personally from the trip, and I'd love to have the opportunity to come again.
Would I come back on another trip? Well, I think we already have one planned for next summer, so I think that's a definite yes.
On behalf of the Minister of Health, Secretary of Health and all of us in the Ministry of Health, and especially the Major Hospital staff. We'd like to say thank you, Canvasback, to Jackie and to Jamie for helping us and wanting to continue with this relationship, because I don't know what we would have done without their service. Because right now, it really helps the patients, help the population, and help the services in the Major Hospital. So thank you so much.